same goes for OB, in my opinion. If you are pregnant, I think you should go to an OB clinic versus like a family medicine clinic. And if you have a MFM clinic or high risk clinic available to you, I think you should seek that out to just see if you can get your ultrasound done there.
All right, well, welcome to the Wellbeing. I'm here, Rachel,
I'm Madison, and we have
and
Sage with us.
and we have Sage with us today. Yay!
Hello.
So today we are talking with Sage. Sage is an ultrasound technician, and we are just talking to her about some of the different things that she sees in her job, some recommendations that she has with working in a high-risk clinic, and some really good questions and things to think about and ask when you go in for an ultrasound, if you ever do, and especially for people kind of looking on their little fertility journey. So welcome, Sage.
Thank you.
Cool.
Thanks for being here.
Yeah, thanks for coming.
I don't know.
We know we know that you are a mom, so you're obviously very busy, had to drop the kids off at daycare to be here. So thank you so much. To get us started, can you just talk a little bit about why ultrasounds are performed, different types of situations in which they are needed, and especially keeping in mind kind of your background with working in a high-risk clinic?
Yeah. So ultrasounds are a big piece of like the OB journey, specifically for pregnancies. Also, you can do other ultrasounds, but the beginning ultrasounds is really going to just tell you how the uterus is growing and like where the baby was implanted or the fetus was implanted and if it's in the uterus or not. So we can start ultrasounds from day one, even like conception of planting an embryo into the uterus. Um, and then even after that, so starting like 7 weeks, we can measure baby, and that's the most accurate time to see if the baby's date is correct. Um, and then growing off of that, around 12 weeks is kind of when we can start to see if there's something chromosomal abnormality going on. So we could see like soft markers, is what we call them in ultrasound, about Down syndrome or trisomy 18 or trisomy 13. Those two are not very compatible with life. So it's nice to know early on if your baby has things like that, because it can affect mom's health as well as the baby's health if you continue with the pregnancy.
Yeah, definitely. And I know, so one question I have, because I feel like I hear this all the time too, is that when you get pregnant, they usually won't let you schedule like your first appointment until you're about 7 or 8 weeks in, right? But you
Right.
can detect and see a fetus right upon conception.
No, you can see if there's a gestational sac forming.
Oh, okay,
So the
gotcha.
first sign of a pregnancy would be with ultrasound would be like a small little black circle that's showing that there is a gestational sac. You wouldn't see like a fetal pole until about 6 weeks.
Okay, so that's usually why they have you wait a little bit longer.
Yes.
Okay, well, that
Yes.
makes sense. Okay.
I have a question. There's like Instagram is not where you should get your medical advice for the most part, but that being said, I not a but, and I should say, I often see people in the like wellness or like crunchy mom community, which like I do not have children, but could see myself being mildly a part of. However, all of that being said, again, why are some people being like, I refuse to get an ultrasound? Have you seen
Because
this?
they're uneducated.
Okay, but like, yes. So there's, yes, uneducated, but why should you get one versus like, why, what did you know the reason people are saying, I don't want to get one?
I think people don't want to get ultrasounds because they're afraid that it's harmful to the baby or to themselves. Ultrasound is completely safe. It's not like an X-ray or CT. There's radiation with those, which could be harmful for you, anybody long term, or any type of exposures. Where ultrasound is completely safe, and I think sometimes people confuse the difference between that. Um, and sometimes maybe insurance won't cover it. Like maybe they don't have
Oh,
insurance, and they'd have to pay out of pocket ultrasounds, even though they are one of the cheapest modalities. they are still expensive, especially if you have to pay out of pocket. So it could be an insurance thing too.
That makes sense. I think that the rhetoric is that there's like EMFs going into your baby and you're going to get radiation poisoning.
Which is incorrect.
Okay. So there's not
Yeah.
radiation from ultrasounds. So how
Absolutely
does an
not.
ultrasound work?
It's sound waves.
Okay. That makes
So
sense.
like think of like this is a analogy we use with patients a lot. Like if you go fishing and you know how you're like looking for the fish and you can like see them swimming on your monitor, it's like sending a sound wave down and it's producing an image back.
So it's like a beluga whale. They use sonar.
Yes, yeah. It's all sound waves. It's all sound waves. Yeah.
That makes sense. Cool.
So
Thank you for that.
this is, yeah, I remember, so Sage and I have like go way back, and when she was in school for ultrasound tech, you'd bring me to like a practical and I was your patient because we swapped, right? Like I
Yeah.
also I made Sage in college, which this is way worse than being her patient. I made her come do a VO2 max test with like the hookup, everything. Like she had to go until failure for one of my practical exams. And so that was, yeah, that was
That's
difficult.
mean.
Yeah, that was
That's a true friend.
the true friend.
It's true.
I passed. So, but she
Yeah.
did have me come in as a patient for her to do a scan on. And I remember looking at the scan, and I remember you explaining to me like the sound waves and everything that I was seeing. And it truly was so confusing for me to understand like the different layers and how you were looking at more of like a transverse like cut of things, correct?
Yes. Yeah. It like flips it on the screen and almost like sideways and backwards. Like anterior is not on top. It's everything's like flipped. Sorry,
Okay.
I don't know how to
Okay.
Like
describe
looking in
that
a mirror.
exactly. Yeah, yeah. So like when I'm looking at the screen, I'm looking at the left side of the screen, but it's actually the maternal right side of the body.
Okay.
So to me, it's backwards.
Okay.
That makes sense.
It
Okay.
does, but it doesn't.
Yeah.
But so it's almost like if you put the ultrasound thing, I don't know what it's called. What's it called? Like the piece
Probe.
of the probe. Okay. If you put it on top of someone's belly, right? Then it makes a picture that goes down. You're not seeing across, you're seeing down.
And then you can, so like there's a sagittal view where you're seeing down, and then there's the
Mhm.
transverse view where you're seeing across. So
Mm.
think of it like we're looking at layers,
Mhm.
like a loaf of bread.
Mhm.
And then we're going through the baby and we're like taking one piece out at a time. And that's how we can like go through the baby.
Got it. That's crazy.
Yeah.
I can't wait to be pregnant so I can get an ultrasound.
And
Yeah.
that's what the tricky
Wild
part
to
is
me.
Yeah.
when I was scanning Rachel's liver, that doesn't move. That just that's where the liver is. It will not move. A baby has its own mind and does whatever it wants. So trying to catch that baby and staying in the correct orientation can be a little bit tricky
Hmm.
Huh, I didn't think about that.
because you can get backwards.
Oh.
And so it's really important to make sure that you know the right side of the baby, the left side of the baby, especially for like situs and bursis. Like you really need to make sure what side you are on.
Or else
Yeah.
you would think they have situs inversus, even though they don't.
Yes. Or like if you were questioning a club foot and I thought the right foot was clubbed, but I was looking at the left foot, ultimately, I guess it's not the end of the world, but it's still important to know when that baby comes out that the right foot is something that we're going to need to look at.
Hmm.
That makes a lot of sense.
So can you talk us a little bit through the difference between working at a high risk clinic versus just a typical clinic?
Yeah, so ultrasound has everything in like specialties. If you're going to look at, I used to do vascular. So if you're going to do vascular and you had a problem with your leg, you want to go to a vascular clinic and look at your veins and arteries because they're the best at what they do and they're the most knowledgeable in that specific part of your anatomy. Same goes for OB, in my opinion. If you are pregnant, I think you should go to an OB clinic versus like a family medicine clinic. And if you have a MFM clinic or high risk clinic available to you, I think you should seek that out to just see if you can get your ultrasound done there. You don't need to be seen as a patient there if you're low risk. A lot of people are considered low risk, um, but they can go to a high risk clinic just to get their ultrasound, and that's just by people that do this in the best way that they can.
Got it. So you don't need to have a high risk pregnancy to go to a high risk ultrasound clinic.
Not to an ultrasound clinic, yes, but you would need to be high risk to see the high risk doctor, but you could still have your own OB doctor and just go get seen for your ultrasound at a high risk clinic.
Got it. So like where I live has very little healthcare. We have the hospital, but like there's one OBGYN who delivers babies in this whole town. And like all of Wyoming delivers babies here because it looks over the elk reserve. So like people travel to come here. Okay. So I just Googled it. We do not have that here. We have an ultrasound clinic or a person who does ultrasounds. We have a whole radiology wing of the hospital. It's a good hospital. But if I wanted that, I would have to go to Idaho Falls, which was like 2 hours away. So
Okay.
would you go every single time to go to this like specialty clinic, or you can be like at 24 weeks, or I don't know,
I would
go
do
to
your
this
anatomy
one?
scan at 20 weeks minimum.
Mm-hmm.
Get your anatomy scan done at a high risk clinic just because we're looking at so many things on the baby. And a
Mm-hmm.
lot of times we're taking more pictures of the heart, especially than other clinics are, just because we're trained to do that. And a lot of times our equipment's also better because we're the end of the road. Like there's no follow up that you would get if the high risk clinic can't get it like that. We're the end of the line. So typically we have the best equipment, the newest things out there. So the imaging is just better.
So if I was pregnant, which I am not currently, um, and wanted to fly to Madison, Wisconsin, could you do this for me?
Absolutely.
Okay, maybe I
10
will.
out of 10 recommend. 10 out of 10.
Yes. I would love to do all of people's
Everyone you know.
ultrasounds.
So do you
Okay.
read the ultrasound? Sorry, I have a follow-up question. Do you read it or does a radiologist read it?
So the difference between like my modality of ultrasound and other radiology modalities is that uh, the pictures that we take are exactly what the doctors see. So if we do not image something correctly or we don't image something, the doctor cannot interpret that. Whereas like an X-ray, they push a button and they can see everything that captured and they can go through that. Where ultrasound is heavily tech dependent on making sure that we're capturing everything. So to some degree, yes, we are interpreting the ultrasound. However, the doctor is the one that gives the official report.
Got it. Okay, that makes
So
sense.
between us and the doctor, we can communicate with each other about how we feel about the ultrasound. And that's where like a lot of trust comes in, is to make sure that we both can trust each other and ask questions. But your sonographer knows a lot more than I think people realize,
Mm-hmm.
That makes a lot of sense.
which is hard because then you have to keep a poker face because you could be seeing something horrible, like the baby doesn't have a brain and this mom is so excited. And so I'm just trying to make this ultrasound as enjoyable for her as she can before she gets like horrific news.
Mm-hmm. Yeah.
Yes.
So Sage and I had a conversation like this in January when I was back in Wisconsin. And my background, for those of you that don't know, is also in pediatrics, and especially kids that have chromosomal abnormalities. So a lot of times, like kind of after what Sage sees, kids that are born and are living and need therapy services. And when we went and got coffee in January, and I think we were both just sitting there sobbing at a coffee shop because we were just talking about some of our experiences and like maybe patients that had passed, or like I know you were talking about working with new moms that were pregnant that were not going to have a viable pregnancy, and just how it's hard. I mean, as a healthcare worker, to be in that space and be part of a journey that's so exciting, but also like can be very, very sad at the same time. So how do you deal with working with situations like that?
I think who you work with is so important. I think just because you can go into the room and you can just say, I just had something really hard, and everybody knows what you're going through. And we all care so much about these patients. And sometimes it's just like to talk it through with each other is just healing, but also sometimes you just go home and you just cry
Hmm.
because you want to give these people good news and they're just nothing that you can do for them.
Hmm. Yeah, definitely. That would be so hard.
Yeah, because you're in a high risk clinic, do you find that you see more difficult things than the average, maybe OB sonographer, or do you see equal, like your ratio of difficult things versus quote normal pregnancies?
I would say 90% of the ultrasounds that we see are some degree of abnormal being at the high risk clinic, because if an OB was done or an ultrasound was done at some other clinic and they're like, oh, this looks a little weird, we don't know what this is, but it's not normal, they get sent to us. So that's where we're seeing a lot of the abnormalities, is because we're the ones that will image those things and
Hmm.
help come up with a diagnosis.
Got it.
And did you mention that most of those things are caught or should be caught by about the 20-week scan?
That's the hard part. A lot of things can be caught at the 20-week one. So major heart defects can be caught at 20 weeks. Spina bifida can be caught at 20 weeks. Clubbing of the feet, brain abnormalities, missing kidneys can be caught at 20 weeks. Whereas there's another type of abnormality, which is growth restriction, which is kind of when either genetically something's going on with the baby, which is causing the baby to stop growing, which happens later during the pregnancy, or the placenta itself is just tired and the baby's not growing. So those things we catch around 20, 32 weeks. So that's why it's also important to go to your OB and make sure that you're measuring correctly. Because if your abdomen is measuring, your fundal height is measuring off, then maybe it indicates the baby's not growing appropriately.
Okay. And why is it important for early recognition for things like this? Like, why is it important for you to be able to catch this at like 20 weeks versus 30 weeks?
So if we were going to catch a spina bifida at 20 weeks, if the patient qualified, they could do surgery in utero to help close that spine, which would release the pressure in the brain, which makes then the baby's brain develop appropriately. So earlier the intervention, the higher the outcome of
Hmm.
a positive outcome.
Yeah.
Um, because after a certain point, then there's just nothing they can do in utero anymore.
Hmm. Yeah. I have actually seen a few patients, sorry, Maddie, you go after this,
No,
but I've
yeah.
seen a few patients that have had this procedure done, and which is insane. Like when you actually think about that, how delicate and crazy a procedure like that would be, but also just the fact that they can catch something like that so early and make a difference still before while they're still developing in the womb is just insane to me.
Yeah.
But I've had a few patients over the years that have had that done and had really, really good outcomes.
Yeah.
I all I was gonna say is that I feel like I remember when that surgery first got done. I think it was at UCSF, and I went to USF, which is University of San Francisco, but UCSF is only a grad school. And I remember it being like literally down the street from me. And my mom like sent me the article, and she's like, I was working at the Parkinson's disease clinic there, which has nothing to do with babies. But I was just like, that is literally happening next door, like the first time they're doing this. And it is insane and amazing how A, recently that was discovered, and B,
Yeah.
like how amazing and crazy that is you can do an in utero surgery like that
Mhm.
to help that is wild.
Yeah.
It's
Yeah.
incredible.
Yes. And successful, to be successful and have amazing outcomes, like functionally. Because this is
Yes.
a conversation that I feel like Sage and I have had quite a few times too, is that you get to see the actual diagnosis and the process of development. And then I get to see functionally what's actually happening afterwards. So that's incredible. That is so
Yeah.
cool.
Like full circle. Yeah.
Yeah. Yeah.
How often do they catch things like that prior? Like how often do people miss it?
So things can be missed again because it's tech dependent. Also, you're trying to image something that's inside of somebody else that's moving. So things like baby's position can affect that. if the baby's like curled up and just we cannot see that sacral spine, we're going to miss it if we cannot see it, or it's just not going to be visualized that day. Patient's body habitus also has a high effect on how we can image things.
What does that mean?
So again, sound waves, it's sending in a sound wave back and then producing an image. The further the sound wave has to go, the longer it takes to come back, the blurrier the image. So somebody with like a larger body habitus, that image is going to be a little bit grainier just because it has to go further. So that's also another factor of things that would maybe prevent you from catching something the first time. However, a lot of clinics, especially ours, if we cannot clear this image or part of the anatomy, even if we don't think something's wrong, we're going to bring you back in 2 weeks and we're going to try again. And if that doesn't work, we're going to bring you back in again in 2 weeks. So we would bring you back until we looked at everything on the baby, until we could see everything and make sure everything's looking good.
Is that the standard of care for high ultrasound or high risk ultrasound technology, or is that just your clinic?
That's the standard for all high risk. We have a certain protocol that we need to complete in order to say that this baby is as healthy as they can be in that moment. That's not to say that things won't develop over time, or like maybe something else is going on with the baby that isn't a physical abnormality. But most ultrasounds are going to do everything they can to finish the anatomy that they need to see.
Is that standard of care not at a high risk clinic? Do you know, Sage?
I'm not sure about that. Because I didn't really do OB before I came to high risk. And when I did abdomen in general, if we couldn't see something, they would go get a CT. I'm not sure if other things are followed up as often with ultrasound.
Knowing what you know from what you do at your high risk clinic and like things like that that might bubble up, are there any really good questions that you would recommend people ask while they're at an appointment? Like, is there anything that's really that if you were going in getting an ultrasound on like you're pregnant, throw back to when you were pregnant with twins or just with Graham, and we're going to get an ultrasound, are there any questions that you would for sure ask to make sure that you understood?
So a lot of times the ultrasound tech or the sonographer can't tell you if things are normal or abnormal while they're scanning until after the doctor like officially checks yes or no on those. However, I think asking, like making sure the baby's growing okay, or making sure that the baby has all of their anatomy, or just kind of listening to the sonographer say like, oh, look, there's 2 feet, there's 2 legs, there's 2 kidneys, and just kind of knowing like those are the right things that we should be seeing. I think growth on the baby is important to just kind of make sure that you're comfortable with how the baby's growing. And 4 chambers of the heart. Just ask, just say like, that looks like 4 chambers, and then your sonographer say, yes, there is.
You say, based on this transverse view and the mirrored image, I can see possibly 4 chambers.
4 chambers. I think just giving some grace to your sonographer, knowing that we're there to look for everything on your baby to make sure your baby is healthy. We want to show you their face and we want to do 3Ds because that's cute and it's adorable. However, like we do have a purpose with every other picture that we're taking, to make sure that the baby is healthy and whole.
Do you get yelled at if you can't find the face, if they're like curled up in a weird position?
Yes, yesterday I did.
Oh my God, I'm so sorry.
Yeah. And I'm like, okay, I'm sorry. Your baby's face is into the placenta. I cannot move it away from that. Like,
she's just chilling.
Like it's not
my fault.
Yeah. Yeah, that I get yelled at for that. I get yelled at for telling them the genitalia that baby has. Sometimes they think
Okay,
that
people
I'm
don't
the
want to
one
know.
that chose the genitalia and I didn't.
Oh,
Wait,
but like
like
they
someone
have
wanted a
asked.
girl and you're like, there's a penis, and they're like, no.
Yeah, and they've gotten up and left. So as a rule of
Wow,
thumb, I wait until the very end
you've learned.
to tell them
If they
what it
want to know.
is. Because on
Okay.
the flip side, if somebody really wants a boy and it is a boy, they're going to be so excited and they're going to laugh and like cry and they're going to be so excited, which also makes our job hard to complete because we need to be still as possible to just
Mm,
have the crisp images that we need. So joy and sadness can impact the ultrasound. So just trying to keep it pretty neutral and lighthearted is the key.
That makes
But
sense.
yeah,
wait,
people
like
get
impact how the baby's moving, like if they're super joyful or
not how the baby's moving, but like how they're gonna image, like the image quality reproduced.
in what way?
So, well, so like say you're trying to take a picture with your camera
Yeah,
and you're trying to take a picture of something's moving, it's gonna be blurry.
like if they're moving.
If any, like whatever you're trying to get, yeah, is gonna move. So if
Oh,
the
like if they're
patient's
laughing
Think
moving,
about
or
if you're like
sobbing.
laughing or yeah, if you're like
Okay.
crying,
yes,
like
like your abdomen is like
your
Got it.
moving.
abs are doing this. You know how muscles work.
Yes, Rach.
Apologies.
Yeah, so that can impact
That makes
that.
sense.
Okay.
So with overall maternal health and what you know working as an ultrasound tech as well, do you have recommendations about genetic testing? We've talked about genetic testing and kind of like carrier testing and stuff like that with another uh guest named Natalie, which if you haven't listened to that episode, go back and listen to it. It's all about testing your own genetics and then carrier testing if you want to have a baby. We are curious if you have any recommendations on prenatal genetic testing, when you might need to do it, if you should always do it, uh, if that affects anything that you do.
We work really closely with genetic counselors in our high risk department. So highly recommend maternal 21 is kind of the most common one right now. That also covers gender, which is a lot of people's goal to know, which I understand, but also it can catch a lot of major chromosomal abnormalities. Um, you would get that done around 10 to 12 weeks typically. However, you can get NIPT done at any point in your pregnancy, but the sooner, around 10 weeks, is kind of the most average time to get that done. While I think it's important is because if that blood work comes back as high risk of maybe Down syndrome, then we could do another ultrasound and we could see if the baby has some extra fluid in their skin or if they're missing their nasal bone or if they have anything going on with their heart, because a lot of times with chromosome abnormalities they're going to have multiple things wrong inside of their body. So the sooner we can catch those things, the sooner we could give a prognosis of this child. And also we can monitor this baby as they're growing. So if there gets to a point towards the end of pregnancy where they're like, this baby is not doing well, we can induce and deliver the baby. And then there's a whole team that already knows about this baby's conditions, that they're prepared to do what they need to do to save this baby's life at the earliest possible intervention, versus not getting your ultrasound done, missing a heart defect, and then being born, and then something sounds weird with the baby's heart, and then they have to get all these other teams involved. Um, so just having all the information early on just gets the right people involved in your care plan.
That
Yeah.
makes sense.
Yeah. I have seen this too, like in patients who didn't know that anything was going on, expected to have a typically developing child and have a really typical birth plan, everything kind of go as normal. And then they have their baby and they find out that something massive is wrong. And then they have to be airlifted to something like Children's Hospital. So just like even probably having the baby somewhere that's equipped for things like that, like knowing that they have like a super great NICU or things like that too would
Yeah,
be helpful to
exactly.
know.
A lot of people travel to Madison for that reason too. They'll be like 2 hours away, so they'll know that they're going to deliver here because their baby's going to need extra care that we can provide versus a different hospital that doesn't have the resources for that.
That makes sense. And the NIPT test is a maternal blood test, correct?
It's a maternal blood test, yes.
And they're just somehow through amazing technology are able to measure whatever's going on with the fetus.
That is over my head.
Same.
But yes. And it's just a screening. So that's the big thing. It's a screening. So think of everything in healthcare as like a puzzle, and each thing that you're doing is just adding a piece to the puzzle and to get the full picture. So if your blood test comes back as high risk for T21 or T18, doesn't necessarily mean your baby has it. The next step would be to either do a CVS where they take tissue from the placenta, or you could wait till 16 weeks when the membranes are fused and test the amniotic fluid around the baby, which will give you the baby's exact DNA. Placentas can be tricky because you can have different sets of DNA in there. I might not say this right, but you could have good genes in there and bad genes, or good chromosomes and bad chromosomes, and you don't really necessarily know which one the baby has. But the amniocentesis will tell you what the baby's genetics are.
That makes sense.
So I would wait till 16 weeks if you can.
Okay, that makes sense.
To do the amniocentesis.
Genetics tested
Yeah.
as fast as possible. The second they're born, unless it needs to be earlier. But I'm just fascinated by it. I got all of mine tested, and it's so interesting.
It's so interesting to see like where you come from, basically. What kind of things you're carrying around.
How you detox, all the things.
Quick question on the amniocentesis stage. I know that is voluntary, right? Like you don't have to do that. That is something that you can decide to do with you and your partner, correct?
Absolutely.
And there
that is not
are
something you have to do.
Because obviously the benefits you kind of talked about, like you learn what could be going on so that you can get ahead of schedule and prep for things. But as far as like risks or negative things, is there anything associated with an amniocentesis on that end?
So it can cause a rupture of the membranes, which you could, very small chance, go into labor, in which case you would lose the baby. So it's not something that people take lightly. It's not something they just do because they want to do it. It's something that they do when they need to know the answers. A lot of times, if two people carry the cystic fibrosis gene, they'll do an amnio to see if that baby will have cystic fibrosis.
Okay.
Like that's something that they're like, we cannot see this on ultrasound, but we can do the amniocentesis to see if this baby is going to have that condition before they're born.
Okay. And yeah, go ahead, Matt.
No, the CF gene is fascinating to me because it's already so hard to get pregnant if one of you carries the CF gene because your body just does not want to continue that genetic code. And so it's so fascinating that obviously people still get CF, like, don't get me wrong, I totally understand that. But I do think like genetically, I've heard Natalie, who spoke on this podcast earlier, speak on a whole other podcast about that specific thing and like how difficult it is if a man has the CF gene, even if he doesn't have CF, to get pregnant. So just fertility tip, I guess, if you are having a hard time getting pregnant, oftentimes carrier testing for things like that can be really helpful too.
Exactly. Yeah. It's just going to help give answers. It's not going to tell you what to do with those answers, but it's going to give you answers, and knowledge is power. So it just gives you the choice to make your own decision with more information.
Yeah,
totally.
Definitely. I think we already touched on this, a lot of genetic conditions that you detect through ultrasound, but can you tell us maybe some of your most common ones? And then can you also talk about who qualifies as being a high risk individual?
Yeah, so straight off the bat, if you have a BMI over 30, you are considered high risk. The higher the BMI, the higher risk you are, just because of how your body's functioning. The higher the BMI, the higher risk you are, just because of how your body's functioning. The higher the BMI, the higher risk you are, just because of how your body's functioning. The higher the BMI, the higher risk you are, just because of how your body's functioning. The higher the BMI, the higher risk you are, just because of how your body's functioning. If you have diabetes, you're a high risk because that can affect like the blood flow and the sugars of baby. If you are on any type of psychiatric medications, that can affect you and make you high risk. Maternal complications, cancer, kidney failure, things like that make you high risk. And then also another common one that gets people is being advanced maternal age, which is if you're at the age of 35 when you deliver, you're considered advanced maternal age, which makes you high risk. So those are like the basic automatic high risk things. If we're scanning, so Rachel, if you got pregnant right now, you'd be low risk. You have a healthy BMI, you're under the age of 35, and you've never been pregnant before. If we're scanning you and we see maybe the baby has dilated kidneys, we would just put you in another category of we're just going to watch this baby, but that doesn't make you high risk.
Okay.
So multiple things have to be going on to make you a high risk pregnancy. A lot of twins, if you're pregnant with multiples, twins, triplets, you're automatically high risk because so many things can go wrong with twins at any given point, especially if they share a sac or a placenta. Um, those are things that will get you monitored every other week. And things like if you're growth restricted, those are going to make you high risk because they're going to make sure the baby's still growing and the baby, because if the baby stops growing, they're going to deliver you.
Okay.
What about if you do IVF? Is that automatically high risk?
It is in a sense of you're going to want to go to a high risk clinic because a lot of things with the placenta can go wrong with IVF, or like a heart defect can happen with IVF just because of what happens during implantation. A lot of times if IVF, like we find placenta previous to be really common, which is just where the placenta is covering the cervix. And we don't want that because then you cannot have a vaginal delivery. So if you didn't know that you had a placenta previa and you went into labor, you would have a lot of bleeding and your placenta would try to come out first, which could be detrimental to you and to your baby. So in the sense of we would do a high risk ultrasound to make sure that that placenta is gone out of the way.
Got it. There's a maternal, I mean, I guess some diagnosis, I can't remember what it's called, where your placenta attaches incorrectly to your uterus and like is so attached that it can't come off. And I have a friend who's an OBGYN, placenta crata, maybe?
Accreta, placenta
Akrita.
accreta.
Okay. So
Mhm.
one of my best friends from undergrad is an amazing OBGYN. Well, she's a resident, but she's phenomenal. She's a great human. We love her. And she lives down in Denver and she has seen a couple of babies delivered. She said every time she has her shifts, like 3 or 4 babies are delivered. She's like, it's ridiculous. It's like I'm like not cursed, but like there's
She's
some spell
magic.
on me. She's like magical. Like we're always delivering babies when she's on the floor. So I'm curious. She's like, you can't detect that with an ultrasound, but I am curious if you can detect that with a higher risk ultrasound with better technology. Because I'm terrified of that.
Yes, so it is actually something that we look for. A low risk mom is at low risk for accreta because it's like if you've had a lot of C-sections, like that scar tissue can kind of get sticky and make that placenta stick to it. Or if you've had like some DNCs or any other type of uterine procedures done and cause some scarring in there, that can cause an accreta. Typically, you're not going to see it with somebody that's a G1, which is their first pregnancy, no
I know
birth
someone
yet.
who it happened to. Never. And so now I'm like terrified, right? It's like
Yes,
I'm
it
sure I'm
it
the person.
can
Like it's terrifying.
happen. Um, but we can see signs of it on ultrasound. It's really hard to diagnose with ultrasound. That's why they don't officially diagnose it until you deliver and they can actually see it. But there's signs that we would look for that kind of make it suspicious that something
Maybe you should have a
looks
C-section.
off and then we'll just keep monitoring it.
Okay.
And then so when you go to deliver, the doctors are looking in that same spot too to make sure that it all comes out and it's not sticking. Because there can be degrees of that. So it can like just kind of start to stick, or it can go all the way like into the bladder wall, which is really bad. because then they'd have to like remove some of the bladder. Sometimes you have to have a whole hysterectomy because they can't control the bleeding. So it's not something that is a good
Not to be taken lightly.
prognosis. No. Yeah. So
Okay. And during
that's another reason to go to a high risk clinic is because they're
Yeah.
going to just look at that placenta
Oh God.
maybe a little bit
Move.
differently than somebody that isn't trained to look at it.
I need to move, is what we're hearing.
There's a lot of good sonographers out there that can see
maybe here.
things. I
I need to move.
just think that being at high risk has
Yeah.
changed my view on that. And I highly encourage all my friends and family to go somewhere where they're specialized in ultrasound.
I will be
Which,
driving to Idaho Falls a lot.
OB ultrasounds, sorry.
as for background about Sage, you are a mom of 3 and you were high risk with your twins, technically, right? As a mom.
Yes, because I had boy girl twins, so I die twins, which is the least risky type of twins to have because they're just 2 separate babies. However, in my 32-week growth, William started to slow down his growth. So then they were worried about his growth going further. So then I got put on high risk for that, where I got weekly monitoring with him. Well, and then they looked at my daughter Tatum too, just to make sure that they're both doing what they need to do. And then William did start to slow down growth even more. So then I got induced. And now he's massive and he's way bigger than a sister. And he was ready to come out, and she wasn't, but it's fine. Yeah. So I'm really thankful for my team there because I trust all the doctors that I work with. And I didn't want to be induced. I was induced with my first pregnancy and it was fine. I just wanted to experience what it'd be like to have a natural labor. However, my doctors were telling me that I should consider this, and I have to trust that they have my best interest at heart too, because that's what they're good at, right? Like I'm good at what I do, they're good at what they do, they have the experience on their side. So I think just really trusting your providers and just being honest with them is what also is important. Another thing about this, I'm going to tangent quick. If you do not like your OB provider, get a new one. There's a lot of OB providers out there. There's a lot of personalities that you're not going to match with. So if you're not feeling it with that one, find a new one. That's okay. You want to do this with somebody that you trust and that you feel good about.
Yeah, I know a lot of people here who drive 2 or 3 hours a couple times a month to go to a different OB. I mean, the OB here is wonderful, but not everyone's not for everyone, right? And so
Exactly.
there's literally one, like I said, one doctor who delivers babies. There's a couple other OBs for general gynecology. I guess they're gynecologists, but it's hard. I mean, we live in a small place. There's only one. So I know a lot of people who drive like over to Idaho Falls or even down to Salt Lake City, which is 5 hours for their fetal medicine care.
That's insane. But when it's something that you're so passionate about and you want to make sure everything's good, you're like, what's 5 hours?
Yeah.
A few months of your life.
Yeah.
Yeah.
In the grand scheme.
It is kind of crazy to me. Like something that hits home with me is how many choices you still have to make. Like, first of all, choices prior to attempting, to get pregnant, and then choices that you have to make through the pregnancy journey, even if everything is going as typical or as it should. And so I feel like having a team of somebody that you trust, where if they give you their opinion or advice on something, would be just so helpful, knowing that I don't know, that, I mean, one thing that me and Maddie talk about all the time, and one thing that me and Sydney talk about all the time with our company Baby Fit, is just providing information that is research backed, clinically proven, also like and like thirdly, because we know there's not enough research out there and there's not enough good research by far, is provided by professionals who have really good experience. And so like when you marry all those three things, it's just so helpful to find a really good team. So it does sound worth it to find
Yeah.
someone in a team that you can trust. So Maddie, you might have to come to Colorado.
I know. I tell my friend, I'm like, I want you to deliver my baby. She was like, it's literally illegal for me to deliver your baby. We're too good of friends. I'm like, okay, well, who do you like the most?
Yeah, you're like, well,
Like,
she can be your doula. She can be in
literally,
there and making
literally.
sure the vibes are good.
Exactly. I'm like, I need you to be present because, like, when our other friends give birth, like, we'll be texting. She's like, this is weird and that's weird. I'm like, I need you to tell me that when it's me
Yes.
versus like she's telling me and it's like our other friend and I'm like, no, you need to tell me what's going
Yeah.
wrong. She's like,
Yeah.
you shouldn't be
Yes.
doing this. And I'm like, okay, great.
Tell
Me.
me.
Tell
Yes.
me.
Mhm.
Yeah.
Yes.
Yeah. Tell me
100%.
exactly that. Yeah.
Yeah. She's so smart. I adore her. She's great.
I think I sat by her, or she was at our table at your wedding.
Probably.
Right? Yeah.
Mm-hmm. Well, if
Yeah.
you give birth in Denver, I will
You'll hook me up
I'll hook you up. Mm-hmm.
with
Give you the
Anne.
hookup.
Perfect.
There you go.
Yeah, I absolutely would drive to Denver for that. Yeah. I don't
Same.
know.
I
I
honestly might
think,
live at my mom's house for the third trimester at this rate. Like, who knows? In California,
yeah.
like it's just who's to say?
Okay, so I
That's the
have a
other nice thing
question. Oh,
about, oh, I was just
go
gonna
ahead,
say,
Sage.
that's the other nice thing about inductions is that you kind of have a little bit more say in when you're gonna get delivered, and you have a little bit more control over that versus spontaneous.
Mm-hmm. Definitely. My question is this. This is so fun. This podcast is so fun because Maddie and I both work in healthcare. We are both PT specific, which is a really fun twist. Obviously, we have entirely different brains at this point and knowledge on PT and where we stay where we belong somewhat. But Sage, you also are in healthcare. And I think one thing that's really unique about this podcast is that we all still work in healthcare and it's a huge part of our lives. And I think I just want to get your guys' opinions on this and like comments, but I think working in healthcare has made me realize how much quality can vary and that you really do have to be an advocate for yourself and search for a really good quality provider. Kind of to your point, Sage, about like if you're not vibing with someone, find a new one because there is such a vast difference in personalities, quality, background, schooling. I don't know. What do you guys think?
Yes, I agree. I mean, like, I don't think there's any other like. Yes, there's so much. It's like having quality assurance for literally everything, right? Like, there's quality assurance on I don't know, this microphone that I use. Like, why isn't there necessarily on um healthcare? And this is obviously not what we're talking about today, but I'm reading the book The New Menopause by Dr. Mary Claire Haver, who I am obsessed with. She is like I want her to be my best friend. Like I love her. But she is like out here on not a, I shouldn't call it a rampage, but kind of a rampage saying like there isn't care for the menopausal woman. She's like, I have been an OBGYN for 30 years and not once in my continuing education, which I do annually in order to keep my license and all these things, has there been a paper on menopause. And like that's so crazy because they give them like 15 papers they have to read and then there's like a quiz or whatever. And she's like, literally, maybe twice there has been a paper on menopause, and it's not been on like how to properly do HRT or any of these things. And so I just think it's so fascinating that, yes, everyone's doing their best, but like most of healthcare is not healthcare. Most of healthcare is sick care. And I am very passionate in the vestibular world about wellness and how people can take care of themselves. So dizziness and migraine and all these things are not as prevalent rather than being like, here's 17 drugs that you have to take to like slap a band-aid over it. So that's my rant. But yes, I agree with you.
I love the rant. I love
I
it.
did too. Yeah. It hit home. Yeah.
It's frustrating.
I'm gonna agree with both of you.
It's so frustrating.
You need it's unfortunate that you have to ask things and to push for things. A lot of times patients will feel comfortable talking to the sonographers just because we're with them for so long, like about an hour sometimes. Whereas when you meet your doctor, you're with them for 5 minutes and they're like, do you have any questions? No. Okay, goodbye. They're busy. So it's like, it's really important to ask your questions and know that things might be common, but doesn't necessarily mean that they're normal. And then to always bring up a complication that you're having. If you're having a lot of back pain during your pregnancy and people are like, yeah, that's being pregnant. Okay, but there's other things that you can do to eliminate the back pain. So it's just really pushing for that help out there. Sometimes you have to be a little bit more aggressive than you think you should. But in the long run, it's going to save you if you ask the questions and you demand that they help you do something. They're not going to give you pain medicine, but they might send you to PT.
Yeah.
And then it's up to you to do your PT, right? You can't just go to PT one day and be like, it didn't work. So there's a little bit of self accountability too. Like, yes, you have to advocate for yourself, but then you also have to hold yourself accountable to do the work.
Yeah.
Yeah. I like that sentiment that common is not normal. Sorry, I interrupted you.
Totally.
Yes.
Yeah. No, that's so true. I think something that's helped me a lot in this space too is preparing. So like having conversations like this with you, Sage, so that we know what to expect, we know what questions to ask. Maybe if you're somebody that like your mind literally goes blank when somebody asks you something and you're feeling rushed and like overwhelmed, then maybe you're a person that needs to write things down. That is me, and have like a list of questions so that you make sure you cover everything. But I think that is just so important. And I do love just getting like females in healthcare together to talk about our experiences. And I don't know, I feel like when I was a kid, I was like, oh yeah, like they're a doctor, like they know everything, everything is correct. Like if they say they can't help me, then there's probably no help for me. You know what I mean? That, and I know you see that all the time, Maddie, with vestibular group fit and like all of the people that you see for dizziness. I know that Joe, my husband, sees that all the time in the concussion realm with patients having tried literally everything, like so many different things that like to the point of where it's like, how did you hear about that before concussion PT or before vestibular rehab? Like literally blows your mind. But it is exciting that there is hope out there, and it's just in different specialties and people in healthcare who have really pushed the boundaries and figured out like how to do their job really well. And so that is one thing that I've seen you grown a lot, Sage, with like this job and your profession. And I am so thankful that you are sharing all this with us today.
Thanks. I feel like through the years of us like growing up together, we've kind of like bounced a lot of things off each other. Um, I'm very passionate about physical therapy, partly because it works, but then also because you're so good at it and you're so good at what you do, and you've helped me personally with a lot of things. But I always tell my patients, I'm like, you should do PT. You should go to pelvic floor therapy. Peeing your pants is not normal. And there is help for you. Like that's not something that you have to be like, oh, I've had 3 kids, it's just normal. It's not normal, and that can be helped. And I think every pregnant woman should have an automatic PT referral in their chart to use whenever they are ready to use it, and they shouldn't have to beg their doctor to say something's not right. They should just have an assessment that they can go and see somebody and make sure that they're healing, because their body's going to be forever changed
100%.
after going through a pregnancy.
There is a statistic that I'm trying to find, but basically I can't remember the exact statistic, but it's something like if you have urinary incontinence 7 weeks or 7 months after giving birth, there's a likelihood that you will still have it 7 years later. Like the majority of women, which is insane. And it goes back to the common is not normal. And my OB friend, I made her promise me that every single woman who walks out of her OR or out of the birthing room needs to leave with an automatic referral for physical therapy. And she has held true to that, but
that's amazing.
Which is amazing. But she goes, every single OBGYN on the floor looks at me like I'm a person with 7 heads.
That's so crazy.
Which is so crazy. But she's like,
That's
I still put it in anywhere. I don't care. I'm like, I'm so proud of you.
I just think like some people don't want to adapt to new things. And that's
even
sad,
if you don't need it, at least you've gone and
it's
got
there.
evaluated and it's there, and you're like, oh, I don't need to have pain with sex. Like, I don't need to have urinary incontinence. I can jump on the trampoline with my kids. Like, the number of moms that I know who got a full hysterectomy because they were peeing themselves, like going on a run or jumping on a trampoline, is wild.
Yeah.
And like, that is not the standard. It should not ever be the standard of care. Like, you do not need a hysterectomy for that, especially as like the first line of defense. Like, maybe if you tried literally everything, maybe, but like, that has a lot of other implications on your entirety of health, from like whether or not you'll get osteoporosis and go into early menopause, or Alzheimer's in the future. Like, it has so many implications, and pelvic floor
Mhm.
Yeah.
physical therapy has very few implications.
And there's pelvic floor therapists specifically for women and men. Men can also get pelvic floor therapy as well. That's not as common, but
Mhm.
also necessity for some people. And I think that's just not something that people are aware of to even ask
Mhm.
for.
Mhm.
And maybe some doctors aren't aware either, and how
Mhm.
good of the outcomes can come from that, because
Mhm.
they're more of the, here's a band-aid,
Mhm.
come back in a couple weeks so we can give you another band-aid.
Mhm.
Um,
Yeah, we actually have a pelvic floor PT coming on in a few weeks, so look out for that one. It's gonna
oh,
be
I'm
really good.
excited.
Yeah,
Yeah.
I had like a similar conversation with her a few months ago where I picked her brain about literally everything, and it all blew my mind. So I'm really excited to have her on.
Yeah.
Fun.
I did a little bit of pelvic floor therapy. I just really stumbled those words. The twins really messed me up, but I don't think that I would have went to physical therapy if it wasn't for you, Rachel,
Mhm.
because I was telling you about my back and you're like, that is not okay. Like, you shouldn't have thrown your back out doing that. It's like, okay. I should probably go get this looked at.
Yeah, I think it comes down to, as in the US, we have a healthcare system. It exists. Yes, we all know this. The emergency portion of that healthcare system, as in, like if something emergent happens and they have to go to the ER, we're good at emergently reacting to situations and saving people's lives in the moment. As far as like maintaining health and wellness and people feeling good all day, every day, we are very poor, very, very poor at that. And so I think that way, that has a long way to go. And I think that people branching off and creating their own specialties and having these conversations and becoming experts in their fields is amazing, because that is exactly what our healthcare system needs. So
I agree.
Yeah. And those crunchy moms.
the crunchy mom.
Honestly, they're good at a
Crunchy
lot of
moms
stuff.
are getting they're getting a bad rep, but
They
they're
are,
gonna
but
change the world, I think.
yes,
We're
I
gonna
totally
we're gonna go
agree.
back to homesteading.
Yes.
We're gonna make our
Yeah.
own bread. We're gonna can our own foods.
Uh-huh.
No more dyes. I think
Uh-uh.
it's the reset the world needs. So it's
Mhm.
hopefully this new generation.
Yeah. Hopefully it's crunchy dads though.
Oh
'Cause
man. Did I tell you that Clint is now a crunchy dad?
how so?
He just goes, do you know how bad processed food is for us? And I was like,
King. Progressive king over there.
oh, tell me more. He was like, we have to cut out all this fast food, no more chicken nuggets. And I was like, yeah,
I love
okay.
it. I
Mhm.
love it. Go
I was
Clint.
like,
We
I
love
don't know
that.
where the rampage came from, but
I love that.
now he's making his own chicken nuggets.
Go
Okay,
Clint.
king. I love that. I
Yeah.
love that. No, D sends me like Instagram. She's like, should we be changing this? I was like, honey, we haven't had that in our house for 4 years, but
I already threw all those out.
I already threw those away, but I'm really glad that you're bringing this up.
Yeah.
Yeah, like you're like, okay, so I'm not gonna be the only one consciously thinking about this.
100%.
Mhm.
100%.
Especially when it's like
It's a big
yourselves
worry.
and your kids and your pets, like everybody that you love. It's
Mhm.
just easier if you're all on the same page.
Totally. I call our house my fortress. I'm like, I don't want to leave the fortress. There's too many things out there. Like,
This is a safe space.
this is a safe space. This is where I come
I
to
can control
detox.
this.
Mold and fragrance free.
Don't get me started.
Fragrance free.
Don't get me started on the fragrances. Oh my god. Endocrine disruptors. Women are starting their
Okay.
periods as early as 9 because of
That's
them.
what I was just gonna say.
It's
Sorry, I just screamed
crazy.
into that. Some of the patients that we see are 12 years old. That also makes you high risk. Sorry, automatically high risk because your body is this big.
Mm-hmm.
Um, I am terrified for my daughter to get her period
Mm-hmm.
at 9. So
Mm-hmm.
she's got no fragrance in this house.
Mm-hmm.
I mean, the boys, I don't want them to have crazy hormones either. So
Mm-hmm.
it is one of the first things that I cut out. And now when you smell a fragrance, have you noticed this? That it like immediately a headache?
If I
Yes.
walk by a house that has its dryer on and they wash their things with Tide, I'm not okay for the rest of the day.
I'm
I
not
might as well
okay.
fall straight on my face.
Yes.
I
Like, oh, someone wore perfume in my car the other day. It wouldn't come out for 4 days. I was like, I hate you. Never come in my car again.
You're
Like,
not invited.
you're
I
not
was at
invited
the
back.
I was at the gym yesterday and literally the cleaning solution in there was terrible. Like I have kind of a cold, first of all, and
Mm-hmm.
then in there, like I'm pretty sure they switched cleaning solutions and it's so bad. Like I can't even
Oh,
touch the towel. I can smell it from like the other side of the room. And I
uh-huh.
don't know. Yeah, it
That's how I
is.
feel about that Lysol spray.
Mm.
Don't get it near me.
Uh-uh.
I bought
Uh-uh.
it in a pinch because Tatum threw up in the car
Mm,
and because that's what she does. And I was like, I need to just kill everything
yeah.
real fast. And then I was like, I'm gonna like throw up myself because the smell
I mean,
is so bad.
it's horrible. And it's also really bad for you.
Yeah.
Mhm.
Um,
I was like,
plug
why
for
is
my
it
favorite
still
cleaning
on the
supply.
market?
Because America doesn't care about the chemicals you put in your body. Get rid of the
Mhm.
Windex, get rid of the 409, get rid of the Lysol, get rid of the bleach, get rid of your Febreze.
Get rid of your
Yes.
Clorox
I am like,
wipes.
oh, don't even get me started. Replace it all with Branch Basics and Force of Nature. I'm not sponsored by this company. Maybe hopefully
Yet.
one day this podcast will be sponsored by those companies. I'm
Yeah.
manifesting it, but for now, there is no sponsorship. There is no discount code. Just go buy it. You can find discount codes literally
Yes.
everywhere for
Yes.
these things. Go buy them. Force of Nature is a disinfectant. So if your kid pukes in your car, that's what you use. And Branch Basics is literally, that's my dog, will replace every single cleaner in your entire house.
It's
Every
so
single one.
easy.
I clean the
Yeah.
bathroom with it. I clean the shower with it. I clean my tile with it. I clean the ground with
And
it. I
it
clean
actually makes
dishes.
your laundry smell fresh, I will say.
Yes.
Because
It
I think that that's
works.
really hard to do sometimes. And it doesn't smell. It just is like super fresh.
Yeah. I mean, I've been a free and clear girly my whole life. Don't get me started with the gain. But someone said that I needed to smell fresh. And I was like, clean doesn't smell like anything, guys.
Mm-hmm.
Get rid
It
of your
just feels
Glade
clean.
things and I need a
I
minute.
know. Fresh,
But like, I'm not
once you
okay.
get used to it,
Mm-hmm.
you're like, oh, that no smell is a good smell.
Yeah. Mm-hmm.
Yeah.
If you want some fresh air, open your windows.
Yeah, please open your windows. I went into someone's house the other day. I'm like, not okay, you guys. I went into someone's house the other day and it smelled like a trash can and Febreze.
Oof. Oof.
And I'm like, no wonder your periods are literally intolerable. This is one of my very good friends. And she's like, I have the heaviest periods, blah, blah, blah. My birth control's not working. This isn't working. And I am like, okay, let's open some windows, honey, and get a mold test in here and get rid of your Febreze.
Yeah.
Mm-hmm.
This is
But
what we
no
need.
one believes me. She's like, no. I'm like,
You're like, just try it.
just try it for like 3
What do
months.
you have to
See what
lose,
happens. Literally
honestly?
nothing to
Yeah.
lose. Except for the money you spent
Yeah.
on Febreze, which that's your loss.
Yeah.
I'm such a bad person sometimes.
No, you're fantastic. Okay, we should wrap this up, you guys.
Anyways, this is getting long.
Seiji, do you have anything else that you want to share today or anything else on your mind?
Speaking of like just me being a mom, I this morning I actually took the kids to their wellness visits and do not take 3 toddlers to a wellness visit by yourself. It's not fun. But they go through that so fast too. If you have any real concerns about your children, that is the time to ask them and you should write those down. Especially like as the year goes on, you're like, "Oh, this is a little bit weird that they do this. This is a little bit weird that they do this. Let me just write this down so when I go, I can just ask them if this is okay behavior or not, because a lot of times you're there and the kids are screaming, you want to leave, you forget the questions, and then you're like, that was my time. That was my time to
Yeah,
ask the question. Um, Especially because that one's paid for by insurance.
yeah, definitely. And seek out free resources like goals checklists and things like that to make sure that your kids are actually on
Yes.
track
Baby
because
fit.
because
tell everyone.
pediatricians don't have time slash don't have the same skill set that therapists have. So even like certain milestones, they'll check like, are they sitting? And like, nope, they're a little bit delayed, or yes, they are, but there's like 10 other things I want a kid to be doing at 6 months. So plug for that. I have a lot of opinions
Yes.
about that. I could talk for hours, but anyways, that's a really good one. Advocating for your kids is huge and asking those questions. Absolutely.
Go see
Okay.
your physical therapist.
Go see your physical therapist. Prevention. Anyways, Sage, thank you so much for coming on and taking time out of your busy day. We know that you're a mom of 3. You already went to a wellness appointment this morning, so obviously you're so busy. We so appreciate you coming on and chatting with us today and empowering other women and couples on their journeys as they go through life, and then also fertility journeys.
I love that. Thank you so much.
Yes, thanks for coming.
Thank you so much for being here.
Thanks, guys.
Bye.
Bye.
All right, today, my favorite thing that I learned is that anyone can go to a high-risk clinic. And even if you don't go every single time, you can go at least once for like your anatomy scan, or maybe later in pregnancy if you're worried about something and like maybe are a person like me where you are going to be probably worried about everything all the time. So yeah, I'm gonna go at least once, maybe twice.
Yeah, great. That was definitely probably my top one, and especially Sage talking about maybe around like the 20-week mark is a really good place to start if you only have the option, whether you live somewhere remotely, kind of like you do, Maddie, or like say financial reasons are in the play, and starting maybe at the 20-week scan. The other thing that we talked about that I really, really loved was just making a list of questions that you have. And if a question pops up during an appointment, ask it. Like be sure to ask it. And if it pops up while you're getting scanned and you want to ask the doctor, write it down, ask the doctor when they come in. That way you're not blindsided. You do have access to all of that information. Yeah, those are my 2 favorites. That was a really good talk. I loved it.
That was. Me too. Thanks so much for listening, everyone. See you next week.
See you next week.